This is Picot Team 7. My name is Denzel Reyes, and my other group members are Samantha Migalang, Maria Romanovich, and Caitlin Murray. This is Denzel Reyes, and I will be talking about background and problem. So we know that cardiac rehabilitation programs are often recommended to heart failure patients during discharge, and this is with good reason. Cardiac rehabilitation has been shown to increase functional capacity, quality of life, and can even lower all-cause mortality of heart failure patients. The cardiovascular benefits of exercise for these patients are also well documented and is often a main component of cardiac rehabilitation. Other features of such programs include patient education regarding medications and fostering a healthy lifestyle, such as through food choices. Despite the known benefits of these programs, readmission rates continue to be as high as 30% of heart failure patients in the 60 to 90-day post-discharge period are often rehospitalized.
My name is Caitlin Murray, and I am going to be discussing the purpose of our research for this project. So, our goal was to determine whether cardiac rehabilitation programs truly reduce the rates of hospital readmission for patients who are admitted for heart failure. So, our population we specifically targeted were heart failure patients, and the intervention that we wanted to focus on was specifically cardiac rehabilitation programs or exercise programs, and we were comparing it to those who received the standard form of care or to those who simply did not participate in these programs or exercise outside of or adding that into addition to their management. So the outcome that we were focused on was those hospital readmission rates, seeing if exercise kept heart failure patients from experiencing heart failure exacerbation and having to return to the hospital for treatment.
Hi, this is Sam speaking. For our evidence collection method, data was collected through searching for pre-existing articles through databases such as CINAHL and PubMed, as well as through the UNLV library. Articles that were researched include randomized clinical trials and systematic reviews. Keywords included heart failure, as well as exercise rehabilitation or cardiac rehabilitation, and rehospitalization or readmission. Our data was evaluated using the grade evidence rating scale, such as A, B, C, and D.
This is Denzel again, and I will be talking about summary of the evidence. Under certain circumstances, cardiac rehabilitation showed the following benefits: decreased readmission rates and days spent in the hospital with proper compliance, decreased readmission rates when supplemented with home-based cardiac rehabilitation, and when exercise was combined with a multidisciplinary program. Home-based cardiac rehabilitation asked participants to perform aerobic exercises outside of the cardiac rehabilitation facility. And a multidisciplinary program was composed of patient education and continuous evaluation post-discharge. Utilization of an expanded cardiac rehabilitation program has significantly better outcomes for heart failure patients, such as decreased mortality, increased healthy lifestyle choices, and could also lower readmission rates to hospitals when compared to standard treatment. Evidence has shown that cardiac rehabilitation improves both activities of daily living and perceived quality of life for these patients, which could definitely empower them and lower readmission rates. The evidence also suggests that exercise and cardiac rehabilitation programs tend to have more benefits, such as delays in rehospitalization for those who have more severe heart failure and higher risk factors associated with heart failure.
Under the right circumstances and with proper compliance, cardiac rehabilitation was shown to reduce readmission rates and improve the health outcomes of heart failure patients. Other factors are possible causes for consistently high readmission rates, such as noncompliance, misinterpretation of discharge instructions, present comorbidities, and socioeconomic barriers. Further research regarding when to implement cardiac rehabilitation and how to increase compliance rates should be considered. The speaker poster presented by Denzel Reyes, Samantha Migalan, Maria Romanovich, and Caitlin Murray. Thank you for watching it.